Welcome back to 3D Dialogue. I'm Jesse Hirsh. My next guest says that his Buddhist spirituality combined with the work that he does in healthcare goes hand in hand. He is a Buddhist monk who brings his Buddhist spirituality into the healthcare environment where he works as a nursing assistant. Joining me in studio is Tenzin Sherab, a Buddhist monk and nursing assistant here in Toronto. Thank you very much for coming in.
Good morning.
Now, maybe we could start with how you got the idea, or perhaps where you were inspired to bring what would seem as otherwise two disparate areas, but appear to me as having a natural fit.
I feel it has a natural fit too. It came from the motivation to be of benefit, maybe first to not be harmful before I started to engage in practice to change my life. I felt like I was engaged in a lot of harmful activities, kind of naughty, and so in the process of trying to change that, to hold back that harm, it seemed the natural next step was to try to do the opposite, to be of benefit instead, at least to try to be of benefit, because to feel the wish to be of benefit, it takes a long time. It's an ongoing job. And I find part of that process of trying to transform, you know, from harmful to not harmful, to being a beneficial, to actually do things which are, the feedback from people receiving it is, wow, thank you, I feel that you've helped me, is a step on the way to feeling I want to be of benefit.
Now, within the context of healthcare, are we talking about just preventative medicine or also just all healthcare as it exists?
I think healthcare in general is wonderful. The premise is health and caring together. From the Buddhist perspective, our goal as a practitioner is to achieve perfect health, and the wish, part of that is this wish that all beings will have perfect health, mainly mental health. There are things we can do for our physical health. Mental health, I feel, is one of the main contributing factors to physical health. We need to eat right, we need to sleep right, we need to not harm our bodies, but we're going to get sick, we're going to die, we're going to go through this process of death, not easy. So if we approach it with the right attitude, regardless of what we experience, it is possible to experience it not as a suffering. Actually, it can be a transformative experience. So likewise, being in an environment such as a hospital, which I find that I spend most of my time there, even more so than maybe in a so-called fabricated spiritual environment, such as, which is very useful, such as a temple or a monastery. A hospital, His Holiness the Dalai Lama calls them a place to go and experience the first noble truth of the Buddha, which is that all of life is suffering, without the preventative measures of transforming the mind. That's the premise. We do suffer, we have suffering, and we see that when we go into hospital. What does that do? It inspires a feeling of empathy, concern, and ultimately, hopefully, this wish, which is compassion, the wish to remove that suffering. All of it is right there, raw, and I find it gives me chills. I find it a very powerful experience, seeing it firsthand, being, you know, right there with our faces right in it, I find.
Well, and I think you're quite accurate in saying that hospitals really are full of suffering, and that is really a central recognition, I guess, within Buddhism, that life on this planet is suffering. Are there ever a conflict, let's say, between your own practices as a Buddhist and, I guess, the hospital environment itself, whether through the relationships that might exist or through some of the protocols that exist?
It's a good question. I think generally as humans we have more similarities than differences. This is a multi-faith program, so it's important to mention that we all find ourselves in environments where the people around us might be on board in terms of what our view is, meaning they might share it, we might support each other in those views, and we might not. Some of these feelings we have, we share, and it's apparent when we get together that we share them. Oh, I'm having a big problem, or wow, I'm having this wonderful joy, you know. We can share these things. That makes life easy, I find. In terms of differences...
Sort of reduces the burden.
Oh, yes. I mean, people feel naturally more, and I feel more energetic when someone's like, wow, good for you, or I hear you, even just I hear you. I know what that's like. Oh, it's such a reaffirmation. The other side is that with these differences of view, sometimes we need to dialogue. I'm in an institution which is, I'm like the lone Buddhist. Sometimes I feel that way. There are some others, but kind of secret, kind of undercover. Most of my peers know that I have a practice going on, and sometimes my patients go, is there something going on there? And what do you mean? I'm just doing my thing. So sometimes it sort of seeps out because I try to go in with how can I help? And I really wanted to say this, that I find what has helped me probably most of all is saying yes. Not saying, anything other than yes, all these different ways of saying, no, I don't really want to get into that. There are times when we can't get into things, but when I'm asked, can you do this, can you do that, if it's within my ability, or at least saying, yes, I have the wish, I want to help, it is an unbelievable benefit. People feel it right off, and I find that the relationship...
They feel that positive energy.
And then that it's open, that, oh, we have this ongoing, we're starting now this ongoing relationship where we're going to try to make things better. I find that's wonderful.
Well, and it's interesting, you were talking about really the power of the mind and the power of that mental energy. And often people inside of hospitals are afraid. They're afraid of suffering, they're afraid of death. How difficult is it to get them into that positive mind space, to get them into really transforming themselves towards better health?
It's a good question. Sometimes easy, because people are filled with different layers of the mind, but there is, I find our essence is goodness. So if together we go to that place, it's possible to go there. Sometimes I feel like frustrated that, wow, is this ever going to be a pleasant exchange? So in those situations for myself, I approach it with not expecting things to be smooth and nice and sweet. And most of the stories are, oh, my patient is so pleasant today. And those aren't the ones I find that I remember the most. It's the ones that are like,
that are most
wow,
challenging.
Yes, like that person really is rocking my world. Why? I have to pull out the most, I'm challenged to pull out these resources to try to transform the situation. So sometimes easy to go somewhere where we're vibing and we're feeling a loving, energetic exchange, and sometimes very difficult. But I find with the motivation, let's try to approach this as best we can. Usually comes out, if not like, wow, that was so wonderful, at least it comes out better, a little bit more calm.
Well, thank you very much. Unfortunately, we have run out of time, but I think it's really been inspirational to see the Buddhist approach to healthcare, and I think people could benefit tremendously by having a much more positive attitude towards their own health. Thank you very much. That was Tenzin Sherab, a Buddhist monk and nursing assistant. Coming up, one man's journey from Catholicism to Buddhism. You're watching 3D Dialogue.